Thank you for joining this Learning Collaborative learning event on mapping your clinical workflow and identifying gaps. I am Kelsey Jones, and I am a leader for the Malnutrition Quality Improvement Initiative and a supporting team member for the Learning Collaborative. Today's webinar will feature Angela Lago, the Clinical Nutrition Manager from New Hanover Regional Medical Center, who will share some insights about how she identified her malnutrition care gaps and solutions to address those challenges. After today's event, you should be able to identify why mapping your malnutrition care workflow is important, understand how to do that yourself, how to map that workflow, and identify gaps in your malnutrition care processes for improvement, as well as understand some of the different tools and resources that are available to you through the Malnutrition Quality Improvement Initiative to help you select, document, and address your malnutrition care challenges. So to begin, let's talk about why mapping your workflow is important and how that helps you address and select your MQii focus. By reviewing your existing workflow processes, you can see where your processes align or do not align with best practices and where quality improvement may be most needed. What we've seen and what the evidence suggests is that care team members and units are often only aware of what happens in their step of the process. So nurses may only be aware of what other nurses are doing, dietitians may only be aware of what other dietitians are doing, and they may be unaware of the malnutrition care workflow from start to finish, or where gaps are taking place in that workflow, where handoffs and communication may not be as effective as they could be, and even where a specific team member's role may not be taking place or taking place as effectively as it could be because they don't understand how that role contributes to the overall picture. What mapping does is allows your care team to identify what the current process is and compare it to what the evidence suggests your care process should be across all members of your interdisciplinary care team that support malnutrition activities. So let's talk a little bit about the process of mapping your workflow. There's two ways that your team can choose to do this. First, you can track a patient through the care workflow and document those steps using the malnutrition care clinical flowchart template, which I'll show you on the next page. This may take multiple days to complete. You are following a patient in real time who's in the hospital and kind of tracking that process, but it is representative of what is actually happening. Another way that you can do this is to convene an interdisciplinary care team with representatives from various different units, including physicians and dietitians, to talk about what happens in their workflow from the patient's perspective, how they are delivering that care, the timeliness of that care, how that information is documented, and then you can record that information in the flowchart template. And if you can convene all those people in one place, that will take about an hour to complete. You can see here a sample flowchart template. This is available on the MQii website. There will be links a little bit later in the presentation to access this. And what you can do is download this resource and then fill it in based on how this process looks for your own hospital. It goes through each step of the process, through screening, assessment, diagnosis and care plan development, shows you different decision points, and it allows you to document by whom the activity is being done, the timing of each activity, whether you're using a validated tool, how you're documenting different pieces of information, et cetera. What is not reflected here but is also available online is a recommended workflow. So it looks very similar to that previous slide, but it actually captures what the evidence suggests are the correct and best steps to take for most patients who are malnourished or at risk for malnutrition. You can reconvene your team and review those best practices and think about how it compares to your existing workflow. One thing that we do recommend is that you wait to review the recommended workflow until after you have mapped your own workflow so that you do not have any biases or competing thoughts as you map your existing workflow. You may also find the link captured here from the Alliance Nutrition Care Model to be helpful as you think about this process. And then walk through the recommended workflow, which is on the next slide, to compare your existing workflow to this, and note areas where your workflow may be different to identify areas that might be good for your malnutrition quality improvement focus area. So as noted previously, this is the recommended malnutrition care process flowchart, whereas the other one had blanks and areas for you to fill in. This has already been filled in based on what the evidence suggests are best practices, and it includes recommended team members, recommended timing, and recommended process approach. Now, I'd like to turn it over to Angela Lago and have her speak a bit to how her team at New Hanover Regional Medical Center went through this process, what they found, and how it informed some of the quality improvement focus areas that they selected based on that. So thanks for joining us, Angela. To begin, can you tell us a little bit about New Hanover and the work you all are doing there?
Good afternoon. My name is Angela Lago, and I'm the Clinical Nutrition Manager at New Hanover Regional Medical Center in Wilmington, North Carolina. I've been at New Hanover for 9 years, serving as the Clinical Nutrition Manager for the past 6. So New Hanover is located on the southeastern coast of North Carolina and can be described as a combination of a beach town, college town, and riverfront community. We are the largest employer in the county, employing approximately 6,700 people, and we are licensed for 800 beds. We have a Level 2 trauma center, bariatric center of excellence, women's and children's hospital, behavioral health hospital, 48-bed Level 3 NICU, inpatient acute care rehab, orthopedic hospital, outpatient pediatric clinic, and outpatient cancer center. We employ 13 RDs, including myself. 6.7 FTEs cover the inpatient services. 1 RD covers the NICU, and 2 RDs work full-time in outpatient clinics.
And now you wanted to adopt a malnutrition quality improvement project at the hospital-wide level. So can you tell us a little bit about the process and approach that you took to start your malnutrition quality improvement efforts?
So I'll start by discussing the creation of my project team. I truly cannot underestimate the importance of having a strong interdisciplinary team. We have a wide range of specialties, and involvement has varied depending on what we were working on, but the input from the entire group is really what is important when you're working on a large project like this that touches so many areas of your hospital. And as I'm sure you're all aware of, nurses are a vital piece of the puzzle in notifying the dietitian staff of patients that are at risk for malnutrition. Because of this, we realized that we needed to have multiple RNs on our team to represent different units in the hospital. We quickly realized that practice and workflow differ slightly from unit to unit. And then also after our first couple of meetings, I tried to start thinking ahead to the long-range goals with this project, and decided to go ahead and include individuals that will be crucial to the overall success as we move forward. For me personally, it has been so refreshing to find team members within our organization that have a vested interest in improving the care of our malnourished patients and who are really passionate about malnutrition. As your project unfolds at your institution, I would like to encourage everyone to remain open to the ideas of your team, and don't be afraid to venture down a road that you haven't thought of before. Sometimes that can be difficult, but participating in this project has really taken me out of my comfort zone, and I've actually found it to be quite rewarding.
So given that you wanted to take on malnutrition quality improvement across your entire hospital, and clearly you recognize the importance of bringing in partners and gathering input from other clinicians to support your activities, including understanding your care gaps. Using that interdisciplinary engagement, how did you identify and select your quality improvement focus areas, and what areas did you choose to focus on?
After completing the malnutrition workflow document from the toolkit, our team identified 3 main focus areas. the nursing admission screen, physician communication, and the discharge and post-discharge process, which is also considered the transitions of care. Since these three areas are all very large projects individually, it has been a little bit of a slower process than I imagined it being initially. As a team, we decided to focus all of our initial efforts on the first major gap in the workflow, which is the nursing admission screen and overall nursing awareness of the role of registered dietitians in the hospital setting. Without addressing the first major gap in the workflow, other changes in the process would have yielded minimal impact. I don't believe that this is uncommon, but we have found that many nurses are generally unaware of the impact that nutrition and the registered dietitian can have on their patient. This, of course, is no fault to the nurses at all, as they have so much on their plates and honestly just feel that the RDs are taking care of the nutrition piece for the patients. On the other hand, the dietitians realize that we rely heavily on the nurses to alert us of their patient's nutritional status because we do not have enough staff to see every single patient that's admitted to the hospital.
Perfect. So we know you all collected data and worked with the MQii team on our end to analyze it and see the impact of malnutrition quality improvement at New Hanover. What have you learned from this data, and how have you used the data to communicate about this project and plan further interventions within your hospital?
Until reviewing the MQii performance results, I really had absolutely no idea how great the problem of incomplete screens actually is at our facility. As you all know, it's a Joint Commission and DNV requirement for the screen to be completed within 24 hours of admission. We have considered multiple different interventions to correct this, but we are currently leaning towards sticking with the validated screening tool and relying on nurse education to reduce the amount of unsure weight loss selections and incomplete screens. When you have all this data available, you can also look at how your staff is performing. This data also demonstrates another gap that we need to address in caring for our malnourished patient population. We will be using this data to determine how many RDs do we need to meet our goal of meeting or exceeding the best practice guidelines.
Was there anything that was surprising to you or particularly stood out to you after participating in the MQii and taking a closer look at how care for malnourished patients was being delivered at New Hanover?
I was surprised, kind of yes and no. As I've said, the dietitians and I felt the gaps. We knew that there were gaps. We knew that we were getting a lot of inappropriate screens. I just really don't think that we knew how many we were getting. So that was a big surprise. And then also just to see the amount of screens that were left blank. That has been something else that we've really been delving into, and that has been the biggest surprise for me, the amount that are just not done.
Thank you again for joining us, Angela. You've shown us how to think about your malnutrition care gaps and given us some great ideas for how to address them with partners throughout the hospital. Do you have any final thoughts for those working to implement their own malnutrition-focused quality improvement effort?
So I'm going to wrap up by just encouraging everyone to talk about malnutrition anytime you have the chance. Educate your dietitians, your director, your executive team. Honestly, my staff is probably tired of hearing me talk about it, but they are really one of the reasons that I'm so passionate about it. It's giving me the platform to demonstrate the skill set and value of my staff to our entire organization. It has been my goal since taking this position to boost my RDs up above the radar, to make them visible, and to provide a valuable service to establish themselves as part of the care team. They have done that, and it's really paying off for us here at New Hanover. There's so much research out there to support a malnutrition program. The MQii toolkit has great resources that are just there and ready to be used. Take advantage of everything that it has to offer, and it will make your journey much easier. I really encourage you to create a team of high performers that are passionate about making a difference and doing worthwhile work. And finally, this project can be very overwhelming. When I first started this journey, I did not really understand where I was going. I just kept marking one thing after the other off of my checklist, and as I continued on, my understanding of the project as a whole really cleared up. I still have moments of feeling overwhelmed, but I just focus on doing the next right thing. And that is what I encourage each of you to do. Just do the next right thing for your staff, your patients, your organization, and your community.
Well, thanks again to Angela for joining us. I think she gave you a great sense of how they evaluated their current clinical processes at their hospital and selected and prioritized among a number of different quality improvement areas to determine which areas to focus on, what would best meet the needs of their facility, and how to go about introducing interventions to address those care gaps. So I want to help provide a little bit of information about some resources and tools that you have available to you through the MQii to help you select your quality improvement focus and identify an intervention to address those care gaps. One resource that matches up very nicely with that best practices recommended clinical workflow flowchart that I showed you earlier is the best practice guidance. In the appendix of this deck, there are slides with best practices for each step of the recommended malnutrition care workflow. We strongly suggest that you review these slides after you walk through the recommended workflow to consider best practices upon which your facility could improve. And this will outline, again, a little more detail about the timing, the care team members, and some of the best practices and key steps for addressing malnutrition care and doing so effectively across screening, assessment, diagnosis, care plan development, monitoring and evaluation, and discharge planning. Another tool that you may want to use as you are evaluating your workflow and thinking about where gaps may exist is the Care Assessment and Decision tool. This tool helps walk you through a number of questions to help you think about how you currently deliver malnutrition care and think about different areas where care may not actually be aligned with best practices or may slightly deviate from what is recommended by the evidence. So for each phase of the malnutrition care process, a series of anywhere from 3 to 5 questions will be posed, yes or no questions about how you deliver care. And for the areas where you routinely are answering no, that may suggest an area where you may want to focus your quality improvement activities. Once you've gone through that workflow mapping process, perhaps looked at some of the best practice recommendations and the Care Assessment and Decision tool, you can use this prioritization matrix to determine which project to focus on first. What you may find is that having gone through that workflow mapping process, there have been a number of different gap areas or areas and opportunities for improvement that you identified. Perhaps you identified opportunities in screening, diagnosis, and discharge planning. What the prioritization matrix will do is allow you to think about the opportunities across each of those areas and consider whether each opportunity is high volume, is problem prone, and will require a lot of resources or minimal resources in order to address it. That will help you think about which areas you may want to focus on and which you can do so with the greatest ease or that will require the least amount of resources. In addition to this matrix, you may also want to just consider at a high level what is the value to the patient or facility if that change is achieved, and the feasibility of implementation. Is this an area where you're likely to get a high level of leadership buy-in? Is it an area that is closely aligned with existing hospital programs and goals? For example, discharge planning may be closely aligned with readmissions reduction. Diagnosis rates may be aligned with ensuring that better patient documentation of malnutrition is taking place. And also staff buy-in for change. If you have a highly motivated group of clinicians, for example, if your nurses are highly motivated and engaged around malnutrition, then targeting things that they are involved in, such as screening, intervention implementation, even discharge planning to a certain extent, maybe where you could have the greatest impact because you have a lot of engagement from that group. Finally, the project charter is a resource that is intended to help you think through all components of your project and help you figure out how best to roll it out and implement it within your hospital. Using this resource, you can document your quality improvement focus area and improvement goals. You can note the project team members and specific roles and responsibilities for the implementation activities, the intervention to achieve your quality improvement focus goals, and the approach for monitoring change in your hospital during implementation. Project Charter is also something that we ask that you complete as part of your participation in the Learning Collaborative. So as you have selected your quality improvement focus, we strongly request that you complete your project charter and return it to the MQii project team as soon as you can. Again, some of the resources that I walked you through during this presentation include the Malnutrition Care Clinical Flowchart and Flowchart Template, the Toolkit Best Practices, the Care Assessment and Decision Tool, and the Prioritization Matrix and Project Charter. Links are available to all these resources, and you can access them online or download them using the links provided here. Should you have any questions, please don't hesitate to reach out to a member of the MQii team at malnutritionquality@avalier.com. And as noted earlier, in an appendix to these slides, you will find additional information on those best practices for each step of the malnutrition care workflow. Thank you for joining, and have a great day.